Hey guys, we're going to take a look at the muscles of the pectoral girdle. These next three videos, we're going to cover the muscles of basically the entire upper quarter. So we'll start with the pectoral girdle, then the arm, and then the forearm. If I sound annoyed at all when I'm doing this video, it's because this is actually my third time recording it. I cannot get my microphone to work properly, but I think we're in business, so I'll try not to rush through it too fast, but I'm getting a little bored with it. Not bored, but it's the third time. You get it. You know what I mean. So anyway, let's start with the trapezius. You can't miss it. It's this big old massive muscle that spreads out over your back. It has a pretty interesting origin. It originates up here on the nuchal line and goes all the way down the spinous processes to T12 and then inserts on the scapula and clavicle. I'm not going to ask you about origins and insertions. I just point them out in case they're interesting. All you guys need to be able to do is identify a muscle if I put an X on it on a quiz. But anyway, so the trap really has three different regions: an upper, a middle, and a lower trap. So there they are. So, if you see a X here, you're putting upper trapezius, middle trapezius, lower trapezius. So not too bad. That one's very superficial. We hide it and we can see all the other muscles we're going to be talking about, starting with levator scapula. Levator scapula inserts here on the superior angle and originates on the C1 through C4 transverse processes. Pretty easy one to spot. Just don't confuse it with this guy right here, which is rhomboid minor. Rhomboid minor, which is right above rhomboid major. So it's related to their size. So minor is smaller, major is bigger. Okay, so that's our first four muscles. Pretty easy, pretty straightforward. And then we have this big old guy down here called Latissimus Dorsi. It originates on your back, on your thoracolumbar fascia and spinous processes, but it actually inserts on your humerus. And it's a powerful extensor and internal rotator and adductor of your shoulder. And you can kind of see why. You see it insert right there. Big muscle. That brings us to another very cool muscle called Serratus Interior. Now, it's very hard to miss this one. It has this serrated appearance on your lateral rib cage. But beware, I could also tag it if I'm in a particularly bad mood, which I won't be. But anatomy teachers love to do this. They love to tag it right there. And the reason why they love that is because you're used to seeing this muscle in the subscapular fossa, which is called subscapularis. But on this one view right here, you actually see serratus interior. Now I hit it, so now you can see subscapularis. Kind of interesting. So that actually brings us to the subscapularis, but I want to do four muscles at once. I want to do the whole rotator cuff together. And here it is: subscapularis, supraspinatus, infraspinatus, and teres minor. There's an acronym for that: S-I-T-S. Supraspinatus, infraspinatus, teres minor, subscapularis. They just form this nice little cage around the head of your humerus to keep it stable. Supraspinatus is an abductor, infraspinatus and teres minor are external rotators, and subscapularis is an internal rotator. Together, they really stabilize your shoulder. You may have heard of like a rotator cuff repair. That's typically of this muscle right here because it has a tendency to get pinched in between the acromion and the humeral head, especially if you're doing a lot of overhead activities. If you're a contractor, you're always holding up beams or swinging hammers over your head, you can beat this muscle up pretty good. So best option would be PT to improve, the positional faults of your scapula, so it's not downwardly rotated and protracted. Worst case, you may need to get a subacromial decompression, which is when they shave some bone off of this acromion. That can definitely help and does help. It doesn't really correct the underlying problem though. So you should, if you have to do this, you should still look at trying to fix the problem. Anyway, those are your sits muscles, the rotator cuff. There's one muscle right here which seems like it should be in that club, but it isn't. It's called teres major. It's right below teres minor. Teres minor is an external rotator. Teres major actually goes around the front and is an internal rotator. It's kind of cool because your tricep sort of threads the needle in between these two muscles. But anyway, teres minor, teres major. So quick recap: supraspinatus, infraspinatus, teres minor, Subscapularis, teres major. All right. That brings us to the deltoids. This guy's been working out, it looks like. He's got a big old deltoid. Has a cool origin. It just kind of creates this big old cage around your whole pectoral girdle here in the head of your humerus. And that it inserts on the deltoid tuberosity. So this is kind of like trapezius in that it has different regions. So here's middle deltoids, posterior, and anterior. They all do shoulder abduction, but anterior deltoids are also involved in shoulder flexion and horizontal adduction, and the posterior deltoids are involved in extension and horizontal abduction. But they're all abductors. Really though, it's supraspinatus that does the first little bit of abduction, like the first few degrees, and then the deltoid kicks in. All right. They make your platysma huge. It doesn't really look like that. I've never seen one like that. But anyway, here's Pec Major. Has a pretty large origin. It originates on the sort of anteromedial clavicle, sternum, and costal cartilage 1 through 6. And it inserts on the IT groove, just like Latissimus Dorsi. And it does internal rotation like Latissimus Dorsi. It also does horizontal adduction if you picture like a bench press, or flexion if you picture, a push-up with your elbows tucked in, shoulder flexion. It can actually do shoulder extension too if your arms are overhead. So it's one of those weird muscles that can do flexion and extension. And I think that's why they sort of drew this little like corkscrew looking thing in here. It's because your arm can flex 180 degrees. So as it comes down, it kind of winds that up. I'm not really used to seeing it like that, but it's on a cadaver, it's so tough because there's so much fascia and fat. It's hard to say. So anyway, that's Pec Major. Underneath is Pec Minor. Pec Minor actually only attaches to the scapula. It doesn't attach to the humerus at all. And it does all those bad posture motions like scapular depression and downward rotation. Actually, this muscle can get pretty tight if you have bad posture, forward shoulders. And so it's a tough one to stretch, unfortunately. But I know mine's probably pretty tight. And to confirm, if I push on my coracoid process, I want to cry. So I'm sure it is pretty tight. And then our last muscle, I believe, our last muscle for this video is subclavius. It's not too exciting of a muscle. It's interesting because it's sort of tough to figure out why we need it and what it does exactly. It does clavicular depression, and it pulls it medially for some reason. It must have to do with the motion of the sternoclavicular joint during scapular abduction and adduction. I'm sorry, not scapular, sorry. Shoulder abduction and adduction. But anyway, it attaches to the first rib in the subclavian groove of the clavicle. And that's it, guys. That is our pectoral girdle muscle video. The next video will be on the muscles of the arm, followed by everybody's least favorite, the muscles of the forearm. Thanks.